We are living in a major historical event, the COVID pandemic, the latest in the long line, starting with the antenatal plague. Throughout history, scientists have worked to understand disease transmission and mathematicians to model it, applying math to answer two fundamental questions. What can we know and how can we know it?
Enter compartmental models, an epidemiological tool that divides populations into stages according to their disease status and tracks the rate at which individuals move from one stage to the next. Like the SIR, susceptible, infectious, removed. Susceptibles are individuals who are healthy but could get infected. Infectives have the disease and can transmit it. Removed people can't get it again because they're either immune or dead. The SIR model's differential equations describe how the infected population will change over time, and integrating them tells us how many will be affected by a disease outbreak. S and I share the transmission rate with opposite signs. So the faster people leave the S category, the more infectives we have. By the end of an uncontrolled pandemic, 85% of the population has had the disease, and almost 18% were infected at the I category's peak, causing avoidable deaths and forcing hospitals to selectively treat patients. How do we stop this? We change what's in our control, our behavior. Enter R0 and R. They describe how many new infections are generated by a single infective, depending on the contact rate, mean recovery, and fraction of the population that remains susceptible. Now, if R is greater than 1, the disease becomes an epidemic. If R is equal to 1, the disease remains endemic, and if it's less than 1, the disease dies out. Therefore, the goal is to lower R below 1. Two human variables influence R and R0. The first is the average number of contacts between susceptibles and infectives. The second is the probability that an instance of contact leads to a new infection. Measures such as social distancing and lockdowns lower the first variable, while habits such as wearing a mask in public, good hygiene, and routine disinfection of surfaces lowers the second. When instituted 30 days after the initial infection, these control measures make R drop from 2.2 to 0.73. No more than 18% of the population is ever infected. But if they're called off after 2 months, R falls to a low of 0.75 but returns to 1.86. So the end results are almost the same as if no action was taken whatsoever. But what if we hold intermittent lockdowns and follow safety measures in between until a vaccine is available? Healthcare need never exceeds capacity, and most of the population remains uninfected. A possible success story.
Pandemic modeling is a crucial guide for modern policymakers, but it's not infallible. The simple SIR model is routinely expanded upon to account for the new characteristics of an emerging pandemic, turning into equations like this. But understanding the science and math behind pandemic modeling enables us to connect the dots between the projections and our current situation. And these numbers tell us that measures taken by governments and the behavioral changes that we adopt make a difference. Mathematicians and epidemiologists can only predict what may happen. What will happen is up to us.